Today we will be talking about congenital heart disease, or in other words congenital heart defects, what they actually are, how they present, what is their signs and symptoms, how do we diagnose them, how do we manage them, and how do these children after management, that is treatment, how do they act. Congenital heart diseases are the diseases which are present in our babies since birth, but they can be diagnosed later in age also, and they are very common, like it is in the frequency of out of all 100 babies born, one can be born with a congenital heart disease. So how do these congenital heart defects present, like what are the signs and symptoms, and how can we recognize them? So starting, these congenital heart defects can be identified in the intrauterine life before the baby is born. Normally, a TIFA scan is done around 18 to 20 weeks of life, in which different parts of the body are scanned and in which heart is also seen. And if there is some anomaly in the heart, they can send us for fetal echo. Fetal echo is a special type of ultrasound in which we specifically see for the heart of the babies. In this, we see the different chambers of the heart, how are they connected, how are they functioning, how are the different walls of the heart working, if there is some obstruction or leakage in the wall, what is the heart rate of the baby, is it very fast, is it very small. So these precise things can be seen in the fetal echo, and appropriate management to a limited extent can be provided at that time. Second, now the baby is born. So the babies who are born with congenital heart diseases can present either at the time of birth or they can present later, and it can be as later as in adulthood also. So these babies can present with bluish discoloration of their limbs, oral cavity, around the mouth, which we call as cyanosis. They may be not able to keep in weight, or they do not grow in according to their peers. They are not gaining weight appropriately, or they have signs of like rapid breathing is there. We can see some retractions or indrawing of the chest is there below the chest, or there is excessive sweating in these babies. They are not able to gain weight, failure to thrive is there. They are being repeatedly admitted in hospitals for their symptoms. So these can be some of the signs and symptoms in which we need the help of a pediatric cardiologist to suspect a congenital heart disease, and we need to visit them. These babies can later present in their lives with like failure to perform their work activities according to what is expected. They are unable to do exercise properly, they are getting tired easily, easy fatigability is there, or sometimes these babies also present with something known as syncope, in which they get unconscious and all.